Is your practice running efficiently? Are you running reports and tracking your productivity from time to time? What metrics are you using to make sure that your healthcare organization is making as much money as it should be? How do you know if you're maximizing your exam rooms, provider schedules, staff, overhead, and coming out in the black or hemorrhaging your dollars? Well, let's look at the metrics. How many exam rooms do you have? How many providers do you have? What resources do you have? Now let's go ahead and look at how many patients that they're seeing per hour, per week, per month. If your providers are seeing a patient every 20 minutes, they're able to see 3 patients an hour, that would be 35 office hours per week, which would be about 105 patients a week. Of course, the new patients would take much longer than the existing patients, but let's say an average of 20 minutes per patient was sufficient for seeing patients, doing the refills, conducting the different huddles, and doing other aspects to ensure your quality is there, then we would be able to keep that number to be able to say how close are we coming to that number of 105 patients per week within this type of a setup. If you have additional space, of course, you'd be able to see even more patients. So for example, if you have 2 exam rooms, maybe you could have 2 providers, and that could be 210 visits per week. So again, you want to be able to assess how well you're coming to maximizing the productivity of your assets. So going ahead and making sure that you have full visits may mean that you're ensuring that you're making the most amount of money, and of course making sure that that is within a frame that actually is reasonable to make sure that you're still not impacting the quality of your patients' outcomes. So let's say if you had 2 exam rooms and you only had 1 provider, and by getting that additional provider, you would be able to make way more money, because by not having that additional provider, you would be losing, say, let's say if you made $75 a visit, and then that would be times, let's say, the 105 visits per week that you're not having, that provider productive, that could be a loss of $393,750 over 50 weeks. So again, really making sure that you are aware of the number of exam rooms that you have and the number of potential patient visits that you could have been seeing is really important to be able to measure and assess the type of productivity that you should be having. Additionally, we also have to keep in mind, by hiring that additional provider is not necessarily going to be an income of $393,000, because again, that will be if you are able to maximize your collections, maximizing your marketing, to being able to make sure that also you're offsetting this by the salary you have to pay the provider, the salaries you have to pay for the additional support staff, etc. But again, if you already have, let's say, the basic infrastructure in place, you already have a medical assistant, you already have the exam room just sitting there, by not utilizing it, you really are wasting that money and just kind of letting that sit on the table. So of course, if you're having trouble finding a provider to be able to fill that slot and be able to see those patients, you can go ahead and reach out to us. Or if you're having trouble finding patients to fill those schedules, you can reach out to us and we'll be able to help get you the marketing that you need to be able to find those additional patients. But again, other ways that you can optimize, your efficiency may be to expand your hours. Maybe that you already have the right amount of providers, right amount of patients, but you can also, of course, expand the hours to be able to provide services to your patients on the weekends. Maybe have, some sort of a schedule where you are staggered, so that way you can be able to see one provider's patients during their lunch, so that you can be able to see patients the entire time. But of course, any type of a streamlining or optimization would also save the number of hours your providers are working. So instead of, let's say, it'd be 20 minutes for a visit, maybe it could go down to 15 minutes per visit. Or maybe if currently it's at 30 minutes a visit, because you have to include the refill time, the time ensuring that they're doing their HEDIS coding, all these different other types of aspects of your administrative work. If by optimizing those administrative aspects of your organization, that would then again minimize that amount of time that they need per patient, and which would again increase the number of patients you're able to see per year, which will ultimately increase the revenue and income. Therefore, again, reach out to us. Let's go ahead and discuss, how your productivity is doing. We'll be able to also review your collections, the time in AR, to make sure that you're actually getting paid for all those time, and being able to help you out to be able to bring in more patients or hire more providers to be able to make sure that you're being so productive with your assets and resources. So again, our website is perfectsweat.com. Go ahead and reach out to us, and we'll be able to be happy to assist you.